Meghalaya is battling the second wave of COVID, but prior to the pandemic, an unseen enemy lurks around dark corners and alleys in the form of drugs and substance abuse, trapping young minds in a web that sometimes they cannot escape, and society is yet to come in terms with the menace. On the occasion of International Day Against Drug Abuse and Illicit Trafficking, observed under the theme Share Drug Facts to Save Lives, TNT The Northeast Today spoke to individuals who have, in a way or the other, associated themselves with drugs and programs to control drug menace. Psychiatrist and founder of Suncare, Dr. Sandy Same said that statistics would not reflect the normal situation, as statistics are usually underreported. Children as young as 6 years old are victims of drugs, and an alarming rise of drug users have kept the police department on their toes. However, the apprehension that keeps popping up is the drug cartel is not stopping. The journey to recovery is not an easy one, given the fact that rehabilitation centers are expensive and no government de-addiction centers, which will help the poor.
You find in Meghalaya, if you look at the figures, the national figures, Meghalaya has the highest number of adolescent IV users. Because our young people, let's say, they mature a little earlier and they get used to these kind of substances even earlier. We've had usually 12, 13 is the average age of people who come here. We need more centers for women, we need more centers for children, and we need definitely more centers for men.
According to the National Mental Health Survey in 2016, he said that roughly 25% of people would be affected by substances. CM said,
but that does not mean that all 25% of them would be needing the kind of help, institutional help. Yeah. So we would say about a quarter of them, of the people that are currently living in the state, would be taking drugs in some form or the other.
Speaking on the COVID-19 pandemic in the state and whether it has controlled drug users or not, the administration here said,
drug addiction is something that is, let's say, inherent in people as they grow older. What is required is what the government is trying to do, is to look at the youth and strengthen them. We have these adolescent education programs. You have programs that will teach the youth how to, what we call life skills. Teach them how to say no. Teach them to be able to overcome stress. That is what is important. I don't think there is any change in the sense that people who drink always seem to manage to get alcohol. In the initial stages of the lockdown last 1.5 years ago, at that time there were times when people had difficulty in getting alcohol especially, and they had a lot of problems. But as people got used to the lockdown, I think they've managed avenues to support the habit.
People used to say the drug addict, you say during this is the time where they face crisis, because drug is not available in the market. But we don't find any problem. I think drug is available everywhere, even this time also. I talked to some of them. They say that they don't have any problem, they can drink drug addiction. If they need drugs, if they have money, they will get drugs.
However, the challenges faced by those who are undergoing treatment is different altogether. Neil Jaitley Khongwir, president of Meghalaya Users Forum, explains why.
The major challenges we face during these days, and especially during the pandemic, would have to be getting health services to people who use and abuse drugs in the field, with certain areas being containment zones. Those zones also happen to be hotspots. Hotspots are areas which contain a huge population of people who use drugs. A lot of people who have been stable on treatment, OST treatment, that is opioid substitution treatment, which is given again from the National AIDS Control Organization. During the lockdown period, some of them had to go to their village, some of them had to migrate back home. So they have, gapped out in that OST treatment of theirs, and they've gone back to drugs. And when they go back to drugs, the dangerous thing is they don't again have access to clean needle syringe because of those containment zones or lockdown effect or whatever it may be. Another important thing is that many of these boys do not have any proper documentation. Their whole life they've been using and abusing drugs. So it's very difficult for them to identify themselves, to, access ration, to access facilities. Even, for example, like the COVID vaccine now is going to be very difficult for them to access.
Through the Social Welfare Department, the state government launched the Nasha Mukt Bharat Abhiyan on 15th August 2020 to address the issue and control drug abuse here in the state.
Under this program, 4 districts of Meghalaya has also been selected. The 4 districts are West Chancha Hills, East Khasi Hills, South Garo Hills, and West Garo Hills. Under this Nasha Mukt Bharat Abhiyan, various activities has been conducted by the concerned district administration in collaboration with the other stakeholders and our social welfare officers.
The government has got the Nasha Mukt Abhiyan, where they have engaged government and non-government organizations to join in. If these programs are carried out in the right way, I think they're more or less sufficient. And they are actually doing good work, and they need to be strengthened, they need to be supported, and the government is doing its best to support all that.
The Nasha Mukt Bharat Abhiyan program, will it be of any help? Actually that is still, has to be seen. It's a new program, it has just been launched. It is just taken off in our state. So basically what they do is they target the underage group, the ones that other service providers cannot cater to, 18 plus. So this is below 18. It's a good idea. I totally second it. I say that it's a brilliant idea. But I think the center needs to push more for more such centers in the state and all over India.
According to D.D. Shira, the director, there are 2 integrated rehabilitation centers for addicts in the state of Meghalaya, apart from the few private-run de-addiction centers in the state.
One is Kripa Foundation at Nongsder, Riboy, and one is New Hope De-Addiction Center at Mokasiang, Modengdiang. Apart from that, these are government run. There are 2-3 other de-addiction centers run by private organizations also.
Yeah, the government need to know more regarding rehabilitation, because only this private rehabilitation center is not enough for them.
In fact, we need a center in every subdivision headquarters, because the number of people, as I said to you, the number of people is too much. We look at the percentage is different, but if we look at the actual numbers, it is more. And drugs does not mean only drugs. Drugs means alcohol also.
Rehabs are still lacking very, very badly in our state especially. I see Guwahati Assam has picked up a lot. They are putting a lot of effort from the administration over there, from the government, to address the drug menace issue. The problem is the rehabs in Shillong are still the same that which used to be there, which is Kripa, Hope Center, Sun Care, and a few other private ones which are run by various denominations of the church. A government-run rehabilitation center is a must. Someone who is convicted under the NDPS Act being put in jail just makes things worse, doesn't make it better. So they need a facility where they can send such cases and such boys. Also for those who come from below the poverty line part of society, they don't have money to access such rehabilitations which charge huge amounts of money every month. So a facility which is free, especially for those who cannot afford it, is a must. When we talk about juveniles, I think again juveniles have to be addressed a lot. The amount of youngsters who are turning to drugs below the age of 15 is alarming.
That is why there is a proposal to set up free treatment facilities in civil hospitals of the districts. Already modalities are being worked out, and very soon these facilities will be set up. This is getting delayed because of COVID. Otherwise, this should have been set up by this year only. So hopefully by next year.
The state government, through the Social Welfare Department, had also come out with the Meghalaya Drug Abuse Prevention Policy in 2020.
Through this, there will be a structured approach to combat drug menace in the state. More awareness will be created amongst the public, amongst the youth, and educational institutions will be targeted. And then rehab centers, the addiction facilities, treatment facilities will be set up in all the districts.
In my personal view, I think the most vulnerable district would have to be West Khasi Hills, mainly because there is no targeted intervention by the National AIDS Control Organization. A lot of them are having difficulty accessing clean needle syringe, which makes it very, very difficult and very dangerous in terms of bloodborne viruses, HIV, STI. I mean, till something is set up there, we will not really know how much the population of those people who use drugs has been affected.
Regarding this, number one is yung human touch and law should go hand in hand. For them, they said, I want to change, I want to stop using drugs, okay? But the moment they go out from here, drug is easily available in our locality. So for them, it's very difficult to stop. So that's why relapse case is very, very high. Why? Because anywhere you go, drugs is easily available.
As we observe the event on this day, let us pledge to take part at the community level to stop drug abuse in the state and the country.
So my personal message would be I think it is time for us to act. We all have children, our future generations are at risk. If we do not make an effort now, 5 years, 10 years from now, it's going to show and we are going to feel it. The next generation ones are naturally more vulnerable, and the older generation ones need to be sensitized so as to not, lure the younger generation ones into this.
As we observe International Day against drug abuse and illicit trafficking, I can only urge and request all the stakeholders, the communities, and the youth to cooperate to make our states and the world drug-free.